the APHINITY trial was a randomized phase 3 adjuvant study that really took patients with predominantly stage 2 and 3 disease, although did include some patients with stage 1 HER2 positive cancer, and randomized them to receive chemotherapy with trastuzumab with or without pertuzumab. And we had previously seen data from this trial where there was 45 months of follow-up, and at a median follow-up of about 4 years, there was a 1.7% absolute difference between the two arms favoring the pertuzumab arm, with a hazard ratio of around 0.81. And at that time, we had seen that the benefit of adding pertuzumab was restricted to those patients with node-positive disease as well as hormone receptor negative disease, with really no benefit being seen in node-negative and hormone receptor positive patients. However, at San Antonio, they did present the updated analysis that now had 74 months of follow-up. And at this point in time, the difference did seem bigger than what we had seen at the 4-year follow-up time point, where now we're seeing about a 2.8% absolute difference between the two arms. And we now are seeing benefit that is not just restricted to hormone receptor negative patients, but actually also saw very nice benefit seen within those patients with hormone receptor positive disease, where there was an absolute difference of about 3% in that group of patients with a hazard ratio of about 0.73, whereas in the hormone receptor negative cohort, the hazard ratio was about 0.83. So I think now we're seeing with longer follow-up that the hormone receptor positive patients also gained benefit from pertuzumab. And I think this may be related to the timing at which hormone receptor positive patients recur, which tends to be a little later. So now with longer follow-up, you're seeing that benefit come out. However, the benefit was still restricted to just those node-positive patients where there was no benefit seen in the node-negative patients. And again, at this time point, there was no overall survival benefit that was seen, although there was a trend towards a little benefit in the pertuzumab arm. And so I think we still need to see longer follow-up from the study to see if the survival benefit would come out with longer follow-up. But at this time, again, what we're seeing is benefit from pertuzumab in node-positive patients and seeing benefit regardless of hormone receptor status. And so I think in my general practice, I have been adding pertuzumab to all my HER2 positive patients that are getting preoperative therapy, because I'm giving preoperative therapy to all my stage 2 and 3 patients. And so in this setting, I would add pertuzumab to chemotherapy. Now with longer follow-up APHINITY, we have not seen any new safety signals that emerged. They had continued to follow patients for potential cardiac toxicity, and really the rates of cardiac toxicity were almost identical to that which had been previously reported at the 4-year mark. So it continues to add very minimal toxicity relative to trastuzumab alone.